back, everyone, to another exciting episode of We Heart Therapy. I'm your host, Anabelle Bugatti. You're watching Your Guide to Therapy and Coaching. Now, today we're talking about a very exciting topic, which is counseling for couples with a method called emotionally focused therapy. And we have a very exciting guest with us today, Dr. Rebecca Jorgensen. She has a PhD in clinical psychology. She's been practicing psychology and marriage and family therapy for over 25 years. She has an amazing resume. She is both a trainer, supervisor, and clinician for emotionally focused therapy, as well as a consultant around the world. And she is the founder and co-director of the Training and Research Institute for emotionally focused therapy, which is based in San Diego. So she knows all about emotionally focused therapy, and she's agreed to talk to us today. Thank you for joining us, Dr. Jorgensen.
Sure, glad to be here.
So let's talk to our viewers. So let's say there's couples and they're just sort of browsing for a therapist and wondering, what is emotionally focused therapy and why might I pick a therapist who uses that method?
Well, emotionally focused therapy is one of two researched effective-based forms of therapy. So a lot of therapies will say we're based on research, and they'll make points about research. But one of the things about emotionally focused therapy is it's proven effective. The research is out actually long-term and outcome-based, and it meets all the criteria for standard of care and practice. And so we're not just saying, oh, what makes couples unhappy, what makes couples happy, and let's just base our method on what we think will help couples go from A to B. We actually have a method that has been demonstrated again and again in the research as effective for couples to go from unhappy and distressed back to happy and in love.
And so what makes EFT, or emotionally focused therapy, unique in its approach versus other types of therapy?
Well, there's a couple of things that really stand out to me there's lots of things, but a couple of points that really stand out to me and that seem to make a really big difference is, one, we know how couples work and we know how humans work. So that our brains are made to respond in particular situations, and we use a lot of emotion in our reasoning, in our thinking, of course in our feelings, and loving relationship. When we're in a relationship with our sweetheart, that is an emotionally based relationship. So we know how to work with emotion, and we also know that people are really wired for taking meaning from emotion, but also to be really closely connected with a sweetheart. And so our method is based on using those really profound components of getting connection and getting so that couples are talking at the same level through emotion to get reconnected and back in love with each other. So it's very different in that what we're doing in the therapy is creating new emotional experiences and revisiting what makes the bond strong and meaningful and why they fell in love and want to improve their relationship in the first place are all elements that we're really working with.
So emotionally focused therapy really prioritizes the bond between romantic partners more than perhaps other methods, though all couples counseling, of course, recognizes that when we're in a relationship it's important. But EFT is really based in attachment theory, correct? And the fact that attaching to and being bonded to others is a crucial life experience.
Yeah, exactly. So we're really prioritizing the bond rather than the individual. And what we're looking at is what's happening in the relationship itself. What's the dynamic in the relationship? And then exploring with each individual what happens inside of them and in how they construct their sense of self and reality in relation to their relationship. And so it's, there's a bit of a complex process. And so people have to be highly trained the therapists that do this method have to be highly trained to be very effective. But it's so effective when you're with a therapist that is well trained in this approach because of the components that we're really working with. And the bond is one of those. The romantic bond is one of those things. And then how we process information, how we process emotion, how we as people organize our worlds are all part of what the therapeutic approach is taking advantage of.
That's so important that you say that. And so emotionally focused therapy is one of the most researched and empirically validated models of couples counseling available. And to do this model effectively, the therapists who use this, like myself, I have to admit I'm a little biased. I love emotionally focused therapy and am trained in it as well. So, you know, the therapists who do this are also highly trained so that they can deliver really effective help for couples. And one of the things I know, Dr. Jorgensen, that when couples come into us, we often start to look at the pattern that happens between couples and where the breakdown happens. Could you talk to our viewers a little bit more about that process?
Yeah, I think about our assessment, the way that we look at what's happening in the couple is because there's so much research on it, we really know what we're doing, what the markers are, what the signs are of where we need to begin and what we're doing. Kind of you went into a medical doctor for a different kind of heart problem, right? So that we're really heart specialists in relationships, and we know what those distress patterns look like. So we know, for example, that couples, when they start to get distressed, there's a pragmatic and practical way that the distress escalates, that it gets worse and worse, and how it gets worse across time. So we can assess for that. Where are you in that part of your relationship? How distressed are you, for example? And what does that look like? So who brings up, let's have the conversation? Who gets away from, like, let's not argue again? Who's bringing those kinds of things to the surface? How we respond to them? What kinds of conversations we can stay in, how long we can stay in conversations, especially distressed conversations. Those are kinds of things that we really will look at as a therapist, and that for couples you need to know. You know, if you're a member of a couple, your romantic partner, you want to know, do you feel like that your partner's accessible to you? Do they really understand and get your inner world? When you try to share it, do you get pounced on, or do you feel dismissed or unheard? Those are some of the things that really matter when it comes to the sweetheart bond. Do you feel like you can open up to your partner? Do they listen? So we think about this. Sue Johnson wrote this great book called Love Sense. She reviews a lot of the research and how we operate as human beings. And she also wrote another book called Hold Me Tight. And it's 7 Conversations for a Lifetime of Love. And in this, she outlines accessibility, responsiveness, and engagement, ARE. Are you there for me? Are you accessible, responsive, and engaged? And also, do you need me? Do you need my accessibility, my responsiveness, and my engagement with you? And that really has to do with sharing our inner worlds, getting in sync about our intention, where we're going, what we're wanting to do. And then, of course, in distressed couples, where does that go wrong? When can't we stay or get in sync about those intentions and about really supporting each other and taking care of each other and having each other's backs?
So what I hear you say, Dr. Jorgensen, is a lot of times when couples come in, they're sort of stuck in this pattern, and sometimes they don't know how to get out of it. And there's sort of predictable ways in which couples may get caught up in this disconnection together, and you know, one partner may start to notice it more than the other. Maybe they both do, and there starts to become sort of like a lack of emotional safety. Maybe one person feels like the other person shuts them down or dismisses them or ignores them, or the other person feels like they're constantly being blamed or attacked or, like you said, pounced on. And so when couples come into session for emotionally focused therapy, we sort of look at that pattern that's going on between the couples and we start to go into that and see where they are in that cycle and how we can intervene and help them do something different in a way that creates better emotional closeness and safety.
What we want in our loving relationships and our romantic relationships is, and the research shows this, I'm no different than you, we want this, any couple out there tends to want these very similar things, which is to be able to really, I call it a core connection, like who we really are, that we're seen, we're valued for that, and we can connect to our sweetheart and from a very core place and find that loving connection.
That's so important. It sounds like what you're saying is we all sort of have this need to be loved and wanted, maybe approved of or validated by the other. And when we don't feel like we get that, it can be very distressing for us as an individual and within our relationships.
Yeah, it's very distressing. It's just how do we manage this distress that really comes into play. And one of the things that we can help couples with, that we can, if you're listening, one of the things that a therapist can do is turn to you and find out when this core problem comes up that you're not feeling connected and you can't communicate with your sweetheart about it. What do you do with that? Do you get upset, angry, mad? Do you stuff it? Do you get away from it, start not to think about it? How does it go? And so a therapist will help you with that, because that's part of a relational dynamic, and how it proceeds and progresses is really, really predictable, because we need that core connection. And without it, there's only a few ways that we really can respond as people, and we have enough research that we're able to predict it, outline it, and then the really great thing is what you can understand, what you have research and understand, we can change. And we know how to do that right within the therapeutic office. And one of the other things about emotionally focused therapy is it's a fairly brief form of therapy. Now, it may take months of treatment based on how long it takes to come in for treatment, how long you've had the problem, if you had additional relationship breakups and problems that make that sensitivity even harder. But compared to other forms of therapy, it's brief. So I think of brief as 4 to 6 months probably in treatment. But if I've been together with my sweetheart for 10 years or 20 years or more, that 4 to 6 months is a really pretty short time. And if I had abuse as a child, that makes interpersonal close relationships even more difficult. Spending a year in treatment is, percentage-wise across the lifespan, really very short to get the kind of satisfaction and happiness that we are able to deliver to couples.
So emotionally focused therapy is more brief than other models of therapy, and it's highly effective, which has been researched and empirically validated, which is awesome for our couples to hear. And maybe our couples are sitting here wondering, is this right for me? I think the number one thing I hear from couples coming in who are looking for help is we keep getting stuck in the same fight over and over again. We can't seem to get out. We can't seem to get close anymore. We just feel really disconnected over time. And so when a couple comes into emotionally focused therapy, can you sort of give them a brief snapshot of what the sessions might look like? What are some things they might be asked to do, or how deeply they might explore some issues?
Yeah, well, the emotionally focused therapist is a process consultant. So we're looking at the dynamic in the relationship, and we're helping the couple to see the dynamic, but we're also treating the dynamic while it comes up. So after the initial assessment sessions, then what you can expect if you see an EFT therapist who's well trained is that they're going to help you. You're going to help the therapist outline that dynamic, where you get stuck in it, and you actually engage in conversations with each other with the therapist support that get you back to feeling connected at your core. And so it takes some repetition, it takes some practice, but we also expect those changes to be happening. Like, we're going to do that in therapy, and then you go out and practice what you've done in therapy at home. A little bit like physical therapy. If anyone's ever had surgery or undergone some physical therapy, the physical therapist takes you through the moves. You learn, you see, where do I get stuck? If it's a rotation, for example, how far can I rotate? It's too limited. I want to be able to move some more, have some more flexibility, for example. The therapist is going to move you to how far you can go, and you're going to go out, practice that in between sessions, come back, get a new move, get some more flexibility. And so that's kind of a bit of what we do. We actually do that in the sessions, and then you can go outside in between sessions and increase and improve upon what you did in the session.
So what I hear you saying is, in session we do ask couples and sort of teach them how to talk to each other about the things that are not being said and that are deeper and perhaps a bit scary, but we're there for them. We're not just going to cut them loose and throw them into the scary situation. We're going to help them create emotional safety and ask them to, again, engage with each other in session in a way that's healthy and brings them closer together.
Couples want to talk to each other. That's the problem, is I want to have these conversations that touch me in my core, that are get us really connected and are deeply communicate with each other. And so what they can expect is that get in a conversation. Figure out what's the block for that conversation, and start to have that conversation at the same levels, in one that they can begin to stay in, and then be able to recreate the kind of closeness that they start to experience in therapy at home.
And we also tend to take it slow, right? I mean, even though it's a brief therapy, we don't try to rush them into something they're not ready for, because I can imagine some viewers sitting here thinking, gosh, talking to my spouse about all these issues I've never been able to speak to them about before may sound pretty scary and intimidating. But of course, when you're speaking from a place of disconnection, it's going to sound intimidating. But as we work, right, it will be.
Well, I think a little bit, again, I think it's so much like what happens in our physical bodies, or physical improvements. If I had this, I want to be able to climb that mountain, for example, and the mountain is get really close to my partner and feel really safe and supported and be seen and understood, then, I can't do that just because someone says, this is how you do it. So we actually get on the trail, for example, with the couple, see the kind of pace that they can go, help them develop the strength and the flexibility to stay and go down that trail, climb that mountain step by step. But because we know what really helps to make the movement on that trail, to increase the flexibility and the safety so they can make that trip faster, we're not ever trying to get ahead of what anybody can or wants to do. The couple really designs that part of it.
So we help couples get unstuck, but in a very non-scary kind of way, and we help sort of create safety and eliminate the threat to talking to each other and connecting more deeply.
Yeah, exactly.
Excellent. Well, so if somebody wants to find an emotionally focused therapist in their neighborhood, how can they go about finding one?
Well, there is an International Center for Excellence in Emotionally Focused Therapy, and it has a Find the Therapist page on it. So that is EFT. Had to think for a second. 2 C's or 2 E's. So it's EFT for International Center for Excellence in Emotionally Focused Therapy.com, and go to Find a Therapist. And you can put in by your city, by your state, by your country, and see where therapists are, because we're training therapists around the world. It's in this model. It's just growing leaps and bounds because of the research on it, that anybody that wants to do really effective couple therapy is coming on board, because the research cannot be ignored.
So I hear that folks can find an emotionally focused therapy not only in their neighborhood in the United States, but it's not limited to the US, that there are therapists all over the world who practice and are trained in emotionally focused therapy.
Yeah, absolutely.
Excellent. So we're going to put the link to ICEFT in the description for this channel or for this video. Now, Dr. Jorgensen, if couples would like to find you and work with you or any of the therapists at your center, how can they find you?
Well, they can find me at livinginlove.us. So just all at the URL livinginlove.us. And also, I have a couple of free downloads for your listeners. They're actually, if they're on the mobile, it's they can text into it. So the number is 33444, and depending on which or both, actually, I have two things they can get. One is love tips. So there's some tips, about 11 tips on how they can begin to improve their romantic relationship. And so that's just one word, love tips, to 33444. And the other one is about improving the sexual intimate relationship. And that's called More Romance. So the same text number, 33444, and with the subject More Romance. And there'll be a couple downloads that they can, couple handouts, little pamphlets or handouts that will guide them to both to find me and to actually improve their relationship.
Excellent. So we have some free downloads. Thank you so much, Dr. Jorgensen, for making those available to our viewers. We're going to put the information in this video and in the description so that you can get those downloads and find Dr. Jorgensen. And of course, if you're in Las Vegas, you're welcome to look me up. I'm also an emotionally focused therapist, or you can go to ICEFT and find a therapist in your area, Googling, searching by your zip code or your city or state or your country. Thank you again so much for being with us today, Dr. Jorgensen. We appreciate your expertise and taking the time to be with us today.
I'm happy to help, and I'm willing to take your viewers' questions, and happy to follow up in any way I can help you.
Thank you so much. Thank you guys for tuning into this channel and to this episode of We Heart Therapy, your guide to therapy and coaching. And this is the episode on emotionally focused couples therapy. Again, if you like what you see, subscribe to the channel. More episodes are on the way, so you sit tight and stay tuned.